mortis, cooling of the body. Algor mortis, algor coolness, mortis, chill of death is the cooling of the body that normally takes place after death, where the body temperature equilibrates with its environmental temperature. Algor mortis is usually the first sign of death beyond the obvious and is then followed by rigor mortis. Sometime after death, the body temperature of the cadaver falls. After some hour, it tends to be equal to the temperature of its immediate environment based on Newton's law of cooling. The surface outer temperature falls more rapidly, outer temperature, outer surface temperature for some time than the inner core temperature. Fall of temperature of the cadaver occurs due to cessation of energy production and inactivity of the heat regulating center after somatic death. Loss of the body heat occurs by conduction, radiation, evaporation. When the body is in atmospheric environment, by conduction and convection when body is in water. Curve of the cooling pattern is sigmoid by exponential or inverted S-shaped. Initial phase isothermic. Isothermic indicates that there is no loss of heat or fall of inner core relative temperature for the first 1-2 hours. This is due to the thickness of the skin and subcutaneous tissue, which are good insulators of heat. Some hours after death, the fall of temperature at the inner core of temperature is a regular, linear, and constant pattern. Intermediate phase. Then it gradually slows the temperature of the environment is reached. Last part of the curve, terminal phase, is slightly above the baseline, which is indicating of bacterial activity. For the purposes of estimation of time passed after death, measurement of the inner core temperature is important and is more reliable than the outer surface temperature. S-shaped curve. Pulse. Site to record the inner core temperature is rectum, 8 to 10 cm above anus, external auditory meatus, subhepatic inferior surface of the liver, nostrils up to cribriform plate, intracerebral through the orbit. Method of measurement of core temperature: chemical, not clinical thermometer, 10 to 12 inches long with a graduation ranging from 0 to 15 degrees required. Nowadays, digital probe thermometer is being used, which has a temperature measuring of minus 40 degrees to 110 degrees with accuracy. That is this one, digital rectal temperature. Procedure for measurement of the temperature: the bulb tip of the thermometer is introduced inside the rectum except in sodomy at least 10 cm above the anus. Temperature can also be recorded by making an incision in the peritoneal cavity and inserting the thermometer against the inferior surface of the liver. The time and temperature of the environment is also recorded. Reading should be made at interval in order to obtain the rate of fall of temperature. Use of this method is useful in cool and temperature climate because in tropical countries like in India, there may be a minimum fall in a body temperature post-mortem, and in deserts the body temperature may even rise after death. Average rate of fall of body temperature is 0.4 to 0.7 degree Celsius, and the body attains environmental temperature in 16 to 20 hours after death. This is digital rectal thermometer. Digital rectal thermometer. It is assumed that the body temperature at the time of death was normal, which varies from the 35.7 degree to 37.7 degrees Celsius orally, and 36.7 and 37.5 degrees Celsius in the rectum in males. A rough estimate of time since death is obtained by the formula normal rectal temperature minus measured rectal temperature and a rate of fall of temperature per hour. For temperature countries, the Marshall and Hoare formula is used. Marshall and Hoare formula. Marshall and Hoare formula is used. In a temperature countries, Marshall and Hoare formula is used. Rate of fall of temperature in an average built person is 1 degree Fahrenheit up to 3 hours, 2 degree Fahrenheit up to 9 hours, and 1.5 degree Fahrenheit up to 12 hours. Rule of thumb is that the temperature falls at about 1.5 degree Fahrenheit per hour. Rectal temperature is higher in case of struggle or exercise power prior to death. Low temperature is seen in congestive cardiac failure, hemorrhage, collapse, and secondary shock. Various equations, algorithms, and nomograms using rectal temperature have been developed. Examples of a simple rule of thumb rule for temperature countries: Rectal temperature at the time of death and at the time of death and minus measured rectal temperature by 1.5. Rectal temperature at the time of death minus measured rectal temperature degree plus 3. Presently, nomogram method based by SNG is used. This method is based on experimental data which can be carried out by a simple computer program or by nomogram. Adjustments are built in for the body temperature, ambient temperature, and body temperature, and provides a 95-degree accuracy and estimating the time since death during the first 15 hours. Then error of 2.8 hour. Factors affecting the Algor mortis. Environmental temperature. Major factor. Rate of fall of body temperature is directly proportional to the difference between the temperature of the dead body and the environmental temperature. Air movement over the surface of the dead bodies causes a quick fall of temperature due to increased evaporation of the body fluid. A body kept in a well ventilated room will cool more rapidly than in a closed room. Humidity. Cooling is more rapid in a humid rather than in a dry atmosphere. Since a moist air is better conductor of heat, media of disposal. Cooling is earlier in water and late in buried body. The ratio of rate of fall of temperature in the three media, water, air, or soil, is 4:2:1. The rate is maximum in water, moderate in air, and minimum in buried body, built of cadaver, obese bodies, cool slowly, and lean bodies, especially since fat is a bad conductor of heat. Age and sex. Rate of loss of heat is more in children and elderly compared to adult, because the surface area of the body is more in relation to the body volume. Female retain body heat for a comparatively longer period because of their subcutaneous fatty tissue, clothing or covering of the body. A well covered body retains heat for a long period compared to a naked or thin clothed body, as clothes are bad conductors of heat. Position and posture of the body. If the body lies in a supine or extended position, loss of heat is rapid because greater surface area of the body is exposed, whereas in curled fetal position, loss will be slow. Mode of death. In case of a sudden death in a healthy individual, body tend to cool slowly, whereas in rapid death due to long and wasting illness, body cools rapidly. Next is postmortem caloricity. In this condition, instead of cooling, the temperature of the dead body remains high for the initial 2 hours. This is due to post-mortem glycogenolysis, compulsory phenomenon which occurs in all dead bodies and starts soon after death, produces up to 140 calories. Causes of death. In a death occurring due to infectious disease, septicemia or bacteremia, heat is produced by the action of the infective organisms. If death is preceded by a severe convulsion as in tetanus and strychnine poisoning, it causes an increased body temperature. In case of death due to heat stroke or spontaneous hemorrhages, heat regulation is severely disturbed before death. High environmental temperature in tropical countries, where when the environmental temperature is higher than the body temperature, dead body may absorb some heat. Thank you.